Hi, and welcome to the informational video series on the rules for registered family. This is video number 2. In this video, we will discuss definitions, policies, emergency preparedness and response, children's records, immunizations, parental permissions, arrival and departure. My name is Amy Bowie. I work for the Child Care Licensing Division as a licenser in the Tualatin Field Unit. The Child Care Licensing Division hopes that you will find these videos informative and supportive in learning about the new Registered Family Rule Set. During each video in the series, we will explain some of the key features and highlights of the Registered Family Rules. Another aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Registered Family Rulebook for the full list of requirements and rules. Okay, let's get started. Definitions are a way to support the rules for childcare, ensuring the rules apply as intended. There have been several significant changes and additions to the definitions section. One significant change is the replacement of childproof lock with inaccessible to children. This change broadens the language and provides more flexibility for childcare programs to use various methods to ensure that hazards, toxins, and potentially dangerous equipment are maintained and accessible to children. So while childproof locks are still an option, you can now explore other safe and effective ways to prevent access to a variety of hazards. Some other definition updates include, but not limited to, child with specific needs, developmentally appropriate, physical restraint, play yard, and supervision. Let's take a look at some updates related to policies and the communication of those policies to the parents, volunteers, and substitute providers. First, parents, volunteers, and substitute providers are now required to receive copies in electronic or paper format of your policies and be notified whenever changes are made. This ensures everyone involved is fully informed and aware of the expectations and guidelines that govern your program. Next, the declaration of viewing, which was previously required, is no longer necessary. While it's still important for everyone to view and acknowledge your license, there is no longer a formal written declaration confirming that it has been viewed. Now let's review the specific elements that must be included in your written policies. You must include the name, business address, and business telephone number of the person or persons responsible for the daily operation of the child care home. This is important for parents and others to know who to contact with any questions or concerns. Your policies must outline parents' responsibilities, particularly regarding providing current required information and what they are expected to supply to ensure the smooth operation of the program. Your policies must include a detailed emergency preparedness and response plan. This is essential for ensuring your program is ready to handle emergencies effectively. For additional details, refer to OAR 414-210-0210, which covers emergency preparedness and response. If you or another caregiver provides transportation, your policies must specify the details regarding this service. You must have a clear and easy to understand behavior and guidance policy that outlines how children's behavior will be managed and how guidance will be provided. You must also include information on the prevention of child abuse and neglect and your duty to report suspected incidents, ensuring that your staff, parents, and volunteers are aware of their responsibilities. If you offer night care, it must be explicitly stated in your policies with details on how night care will be provided. These updates are designed to enhance transparency, safety, and communication within your child care program. So it's essential that you ensure your policies reflect these new requirements. Next, let's review the rule updates regarding your emergency preparedness and evacuation plans. These are crucial for ensuring that you're prepared in case of an emergency and that your program complies with the new rules. You must have and maintain a written emergency preparedness plan that addresses evacuation, relocation, shelter in place, lockdown procedures, and responding to medical emergencies and other incidents. The new rule states that you must review the written evacuation plan and all emergency procedures at least once per licensing period and update them as necessary. You must identify a hospital or clinic for emergency medical care. For evacuation purposes, your designated safe areas and alternate shelters must be located at least 50 feet away from the building being evacuated. This distance ensures that everyone is safe from potential hazards or further risks. The new rules address weather conditions, temperatures, and air quality. This update requires you to account for these factors in your emergency plans. You'll need to consider possible extreme temperatures or poor air quality that might affect the safety of children during an evacuation or sheltering in place. You will also need to ensure you have an emergency light source, such as a flashlight, in working condition. These changes are designed to improve safety and ensure that your program is well prepared for emergencies, no matter what kind of situation arises. Now, let's move on to updates related to child enrollment forms and the information you'll need to maintain for each child in your care. You now have the flexibility to store children's records either in paper or electronic format. The key is to ensure that the records are easily accessible and securely stored, regardless of the format. The requirement to include a child's dentist information on the enrollment form has been removed and is no longer required to be collected. Another change is that you must now document that parents have received a copy of your policies. It's an important step to ensure that parents are fully informed about the expectations and guidelines of your child care program. These changes are meant to streamline enrollment procedures while ensuring that key information is collected and stored appropriately. Let's now cover an important update regarding immunizations and how they relate to your child care program. If a child is enrolled in a public or private elementary school, you are no longer required to document their immunizations in their child care file. Immunization records will already be tracked through the school system, and it is understood that the school will meet the necessary requirements for immunizations. The rules have also been updated to allow more flexibility in situations where children may not yet have their immunizations up to date. You may provide care for children who are in foster care or experiencing homelessness, even if their immunizations are not fully up to date at the time of enrollment. This allows parents or guardians the time needed to take the necessary actions to comply with immunization requirements. These updates ensure that your program can accommodate all children, even if they are in situations where documentation or full immunization compliance is temporarily unavailable. Next, we'll discuss the rule updates for parent permissions and when they are required for your child care program. You must have current written permission from the parents for their child regarding certain activities, and these include Written permission must be obtained before child care children engage in high-risk activities such as swimming, mountain biking, or any other potentially risky activity. If you plan to use photographs or recordings of a child for public purposes, such as on social media, in advertisements, or other public-facing materials, written permission is required before doing so. If you're transporting a child or taking them on a field trip outside of the immediate neighborhood, you must have prior written permission from parents. Prior written permission is required for anyone not listed as an authorized person in the child's records to pick up a child from your child care. Additionally, written permission must be obtained before allowing a school-aged child to arrive or leave your child care alone. Written permission is required before bathing a child care child. For chronic medical conditions, you may obtain written permission with specific instructions when administering medication for up to 12 months. Examples include diaper cream and inhalers. Now, if a family is experiencing homelessness, there is flexibility in cases where written permission is not obtainable due to the family's circumstances. Permissions can be provided verbally as long as you document the date and time you were given permission and maintain it in the child's file. Electronic permission, such as through a text or email message, can also be used as an accepted form of permission. These updates ensure that you maintain appropriate permission while also being sensitive to the circumstances of families who may be facing challenges. Now let's cover some significant changes related to the drop-off and pickup procedures for your child care home. One key update is that you must require any person bringing a child to the child care home to remain with the child until a caregiver accepts the child into care. This ensures that children safely transition from the parent's care to yours. It also helps maintain accountability and keeps the transition smooth. For pickup, the new rule states that you may only release a child to the parents or another person identified and named by the parents. This ensures that the child is only released to individuals whom the parent has authorized. If the person picking up the child is not known to you, they must show identification before the child can be released. This is a critical safety measure to prevent unauthorized individuals from picking up a child. Additionally, except as excluded by court order, parents must be permitted access to their child in all child care areas while their child is in care. Advance notice is not required. These updates are designed to enhance safety during drop-off and pickup times and ensure that children are in the hands of those whom their parents have authorized. Thank you for watching this video in our informational video series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.